Greetings, Derek Mounsey here, and today I'm going to spend my time talking about administrative fellowships and the value proposition that they bring to the fellow, him or herself, the preceptor, and the organization. This could be a two-part series because in this first video I'm simply going to walk through a presentation that I did for our department directors, our executive leadership, and our board of trustees about some of the things that I was able to do and get exposure to during my time as a fellow at Hancock Regional Hospital, as well as the value proposition for each of those. So I may follow up with another video talking a little more openly, a little more freely about administrative fellowships. But here's my year in review of my administrative fellowship at Hancock Regional Hospital in Greenfield, Indiana. So my partnership with the organization actually began when I was in my Master's of Health Administration program, when I was randomly paired with Hancock to do my capstone project during our last semester. And so at the end of that project, I was in a little bit of a quandary about my immediate next steps. So I sat down with the CEO at Hancock, Steve Long, and he mentioned the fact that they had a lot of work to do, and it could be an opportunity for me if I was interested. So it was a Wednesday, and I had a call with Steve, and it was exactly 10 minutes. At the end of that 10 minutes, I knew three things. I knew one, I was going to do it. Two, I was going to start on June 1st. And three, I had until the next Tuesday to figure out what it was in the form of proposal of what my next 12 months would look like. So I met with Steve that next Tuesday. We sat down, talked through the proposal, and at a high level, we both liked it and decided to go forward with it with a few tweaks. But it wasn't maybe 2 days after that Steve sent me the strategic plan and a handful of other documents and said, get reading, because when you step in the door on June 1st, we're going to get going. So at that point in time, I kind of knew it was going to be a wild ride, and it did not disappoint. So I had the fortunate opportunity to walk through the door on June 1st of 2015, fully knowing that I had 365 days to make a difference as an administrative fellow at Hancock Regional Hospital. And it didn't take long to realize that not many people knew what an administrative fellow was. So to some, I described it as essentially an internship, and to others, basically a job. But in actuality, it was, and I put 80-20, but most of the time I jokingly say 90-20, but it was about 80% work and 20% learning. And when you put those together, it's 100% both, because everything that I learned made me better at what I was doing, and everything I did, I learned from. But to keep with that 80-20, my learning, I attended educational events. At a national level, I went to student conferences at a statewide level, at a countywide level, at a citywide level, and then at a hospital level. So at all levels, I attended meetings or attended educational events at all levels. I participated in meetings from the board of trustees level down to frontline staff. This was probably single-handedly where I learned the most about what it takes to become in order to be a successful organization, and seeing how different groups of people look at issues or look at things differently just based on their lenses. I conducted research, either it was for projects that I was working on or just out of personal curiosities. I did a lot of research and I did a lot of reading. In this fellowship position, as I told you, some people essentially saw it as an internship, so I took a very student approach in a lot of things and got a lot of reading assignments from a lot of people, which I greatly appreciated, but led to a lot of reading over the course of the year. I was involved in cross-sectional initiatives and meetings. And once again, just being able to work with all types of different individuals in the organization was extremely beneficial. And then I did department visits. And as you can see with the organizational chart here, and what I'll click through here, over the course of the year I was able to visit every single department in our hospital, including our physician network, and some of the other more peculiar ones. But here are my learnings from that. That everyone is very good at their jobs, and very good is probably an understatement. They all come from unique backgrounds. Some were business owners, entrepreneurs. Others were accountants that now worked in clinical care. and others were ski instructors at one point in their careers. Despite what you think you know about them and what they do, it is many keep going times more. I had preconceived ideas of what these individuals did before I visited their departments, and I found out that most times I was right, but that only counted for half or 2/3 of what they did. They actually did many other things as well. Just learning about great cross-sectional relationships and how different departments have grown over the years to complement and really help out and supplement each other. And then there's an immense amount of variation in terms of job responsibilities and core competencies. And using the directors as an example, they're all titled director, but for each department that means something different. For example, in our wound care center, the director of our wound care center actually does a lot of marketing and a lot of selling to the doctors, making sure that they're aware of their services that they provide, so that then when they have a patient that needs wound care, they'll know that we can handle it and then they'll send them our way. Versus the director of our surgery department is more focused on operational efficiency and turning over surgeries. And then lastly, I jokingly say I learned that wound care is not for me. So work, I was essentially the hi-fi guy, and rightly so, because if it was at all labeled hi-fi, I was involved and had the fortunate opportunity to lead a lot of these initiatives, which is a rare occurrence for young careers like myself right out of school to be able to affect change at an organizational level this early on in my career. And here's kind of the very high level of some of the initiatives that we accomplished over the course of the last year and a half, and I give all the credit to the leadership and the individuals in the front line who are implementing these things. Education and training. Had the opportunity to participate in, help plan, execute, and even speak at our quarterly leadership development institutes, where we gathered 100+ of our organization's brightest leaders in one room to improve their skills and enhance their skills and abilities to reignite passion and to realign with our mission, vision, and values. At these LDIs, we recognize individuals that went above and beyond. We raised money for charitable organizations. We brought in nationally featured speakers, and we just built kinship over amazing lunches provided by our nutritional services team. We did chair yoga. We did team building activities, and it looks like some of us even slept. Just kidding. It was part of one of those team building activities. So in addition to these larger scale organization-wide trainings, also did training at department levels, at topic levels by holding lunch and learns, and individuals that are interested in the topic coming to those lunch and learns. Even at individual levels, just helping leaders that build goals or providing input from a kind of a different perspective that I have on the job that they do and different tasks and different ways to look at it. Defining new ways of reaching people and providing that education through starting the Hancock's Initiative for Improvement YouTube page, where we host a lot of our resources and training videos that we're putting up here so that anybody can view them at any time, whether at work or at home, which is now less than a month or two old, has accrued over 500+ views. To marketing, having the opportunity to coordinate the video that celebrated our hospital being recognized as the most wired, to coordinating and help create the videos that will provide our patients, or physician introduction videos that will provide our patients with an opportunity to get to know their physician or their nurse practitioner before ever walking through the door. To David's story, which is one of the most turned out to be a life-changing thing for me, and learning about the heroics that this team that you can see in this picture did and the amazingly kind care that they gave to the individual David in the maroon sweatshirt by saving his life, and then being extremely caring to him and his wife afterward. And I recommend you go to our hospital Hancock Regional YouTube page and check that video out, because that's up there for posting. I guarantee you won't regret it. To even just helping getting new pictures of our organization, kind of as a unintended outcome of one of those videos. I've got some cool drone footage of the organization that we've used in multiple places, to population health and being able to research, analyze, and make recommendations on how our organization can be a leader in providing equitable care to all backgrounds, and to all individuals. To looking at that other 80%, we know that health is defined only about 10 to 20% by actual health care, and the other 80 to 90% is a variation of socio-demographic factors, genetics, and behavioral decisions. So looking at other ways that we can help our patients and partner with our patients in order to impact what we define as health. To my favorite category of all, as other duties as assigned, event planning, to being the phone operator during our external disaster drill because one of the assistants was out, to being a mentor to the sons, daughters, nieces, and nephews of the associates at Hancock that wanted to learn more about healthcare administration and the opportunities that exist. Having the chance to interview physician candidates and make my recommendation to our team on whether or not we should hire that individual. To being a gift drive coordinator for local non-for-profits, videographer, IT support, the list goes on. Professional basketball player during our No Pass Zone celebration event or awareness event too. Just representing a good cause in preventing domestic violence. To Hank, the frog, and that stands for kindness. To the pink glove dance, where I learned that curiosity does kill the cat. And when this is not even 25 days in to me first starting at this organization and just curious about what a pink glove dance was, next thing I knew I was in the background dancing there. So the value proposition is easy to see for a fellow. I feel like after this 365 days at Hancock, I have a clear competitive advantage over my peers because I've had a unique opportunity to translate the theories and the concepts that I learned in school immediately into action in this position. By having an exclusive view, one that most people or most healthcare professionals won't get and don't get until they're stepping into this role, later on in their career. Having that exclusive view, sitting in on the exec meetings and the board meetings and the other director leadership meetings. Most individuals don't get to see these until they step into their role. Having this understanding of the industry and the profession, not only of where it stands currently, but where it's been, and also where it's going. And then enhanced skills and knowledge and experience, that I've been able to accrue just because I've had the opportunity to do, versus just learn, but learning as well. And then for my preceptor, and preceptors I say because I feel like I had a lot throughout my time here, they're getting a fresh insight perspective by me, someone that's straight out of school, thirsty for knowledge, and naive. Don't know a whole lot in terms of how it all works. So I'm asking questions and feel comfortable asking questions that make sure that they have to stay on top of their game and know what they're talking about in order to answer those questions. And then mentor skill development, giving them an opportunity to hone in on their ability to teach individuals and be a mentor. And then for the organization, first and foremost, actual contribution. As you can see in the many slides before, and I don't mean this braggadociously in any way, but I did a lot over the past year because I wanted to do a lot and I was empowered to do a lot. So all of that went back and benefited the organization. And why does that happen is because young careers like myself, we see the value in fellowships. So when you post these and you provide these opportunities for professional educational partnerships, you're going to attract the most highly qualified and highly driven early careerists. You're going to have a pool to choose from where they'll all contribute, almost all, I'll always throw a caveat, contribute value to your organization because they want to, and they want to prove that you are a good investment. They want to learn, they want to get better, and they want to make your organization better. It's also a good organizational development strategy. I've been here for a year and a half in a very probationary role, and had I been coming into this position with the mindset and understanding that we were going to try to funnel me elsewhere into the organization, as I do in some fellowships, then it would have been a great opportunity to be able to scope somebody and kind of carve out exactly who you want this leader to be and where you want them to focus their time and skills. And then shared learning, like I said, being open and feeling comfortable with asking the questions and challenging individuals. And then lastly, Happy Sock Friday. So my takeaways from all of this is that I learned something from everything that I did and everybody that I worked with. I became twice as aware of all that goes into being a successful healthcare organization and being a successful leader, and understanding that even the most simple and straightforward situations are complex beyond what you can even come up with. But having that awareness, I already know is going to make me a better leader, and half as scared because I never had enough time to spend and allocate and dedicate to each of the items that I was working on. So I just had to be confident in my own ability and move forward the best that I could. Kindness can and does cure. What you do changes the course of today, but how you do it can change the course of a lifetime. I saw that firsthand over the course of the last year many times, and just how taking that extra step beyond what's expected is what really leaves the impression and the impact on your patients and on your employees as well. Small changes early on can have a large impact over time, and I speak of myself when I say this and when I think about this and how different of an individual and of a leader and a professional I will be 20 years down the road because of this 1 year, and what I learned and who I met and the relationships that I built over the course of this last year is going to drastically impact, all for the better, the individual and the professional I'll be down the road, and how others can benefit greatly from this as well. The grass is not always greener on the other side. Few other organizations are as blessed as Hancock in this community that I've seen. So just to always be mindful that you're lucky for where you're at and you're supposed to be there. No matter it's 1 year, 10 years, or 21 years, you have a finite amount of time to make a difference and approach each day as if you were on the clock. Like I said in the beginning of this presentation, for me, I knew I had 365 days to make a difference, and having that attitude allowed me to continue to drive and continue to get more done than I ever thought I could in a year. So just to be mindful of that all the time and know that you have a finite amount of time, no matter what that hourglass says or has left in it, it's finite. So just to always be pushing and driving to be better and to get better. And then don't ever take for granted the impact that you can and do have. Despite the popular saying, it does not take an army. A simple smile can change lives. So just once again, to be kind, to be a good person, has impacts on people, communities, populations that you can't even fathom. So despite this being my drive to and from work on most days, all of you at Hancock, and all the things that we did made it well worth it. And I thank you for making it possible.